Dr. Lowe, thank you so much for joining us here on Health Connection. Our topic is menopause, and the subtitle is There is Treatment.
Oh, well, thank you for having me.
We like to start these segments off frequently with a basic definition. What is menopause, and when does it happen in a woman's life?
So menopause, it's a natural event. It happens usually age 51. That's the average age for a woman to go through menopause. It can happen earlier. 45 is about the youngest end of normal, and then all the way up to age 55. That's a normal age range. And it is the end of menstrual cycles for women, and that is due to a loss of estrogen.
And it also marks the end of fertility.
Exactly. So the trick is that we don't know you're in menopause until you've not had a period for a year.
Okay. In addition to menopause, there are the terms perimenopause and postmenopause. What are these distinctions, and why do they matter?
So perimenopause is that time frame when a woman starts to notice changes that are associated with hormone fluctuations. So estrogen and progesterone are the ones that the ovaries make, and it's ovarian malfunction really, and malfunction that results in menopause. So those hormone fluctuations can start with irregular menstrual cycles, heavier periods, less periods. And so when those things start happening, when you start noticing hot flashes and vaginal dryness, that's kind of the indicator for perimenopause. And postmenopause is a woman's entire life after menopause. So with our excellent medical care that we get now, I mean, it's 30 to 40 years.
Very well. Other than age, you just noted milestone birthdays. Other than age, what are the typical first signs that a woman may be approaching menopause?
So usually a woman will start to notice hot flashes. She may notice some mood changes and sleep changes. And vaginal dryness is really one of the first things that a woman may notice, is that sex isn't as comfortable as it used to be. They may have to use more lubrication than they used to. Or maybe they're not as interested in intercourse as they used to be. Those would be some of the first things I think a woman would notice.
Well, let's keep going on that with those things that you notice. When women talk about menopause, you usually hear about hot flashes, you hear about mood swings, sleep problems, insomnia.
Absolutely.
But are there other symptoms a woman may experience during this time in her life?
Absolutely. So women may notice that it's much more difficult to keep weight off, and may even gain weight during the menopausal period. So changes in sleep, mood lability, so more anxious, more depressed. Again, the sex drive that we talked about, the libido changes, is a big complaint that a lot of women will have. But those are the big ones: the hot flashes, mood swings, and memory. Memory is another one that a lot of my patients complain about. I have to write everything down. I feel like I'm in a fog all the time.
Why is it that some women apparently just sail through menopause without any of the unpleasant symptoms, without the complications, while other women just find it an extreme duress?
So a lot of that is genetics, unfortunately. So, your mom's menopause is going to be an indication of how yours is going to be, including age and how her symptoms were. Some of the other things, though, if you smoke, or if you're in smoking especially, is associated with worse menopausal symptoms, so more hot flashes, more severe hot flashes. And then race has something to do with it too. We know that African Americans tend to have more symptomatic menopausal transitions than Caucasian or Asian women.
Okay. Do you recommend hormone replacement therapy for those going through menopause?
Absolutely. For the right woman, it's a very good treatment, and it's actually the gold standard treatment for hot flashes and night sweats and other menopausal symptoms.
Are there other medications or treatments that can reduce the unpleasantness of menopause?
Sure. The FDA has approved, there's one medication I know of that's approved, Brizadel, which is an antidepressant that's approved for hot flashes and night sweats. But there are some other medications that can be used off-label for symptomatic treatment.
When you say off-label, what do you mean?
I mean, the FDA hasn't approved them, but years of experience have told doctors that they work and that they're effective.
Has the diagnosis and treatment of menopause changed through the years?
So the diagnosis hasn't really changed. We know more about menopause than we used to, but the treatment, I think, has evolved some. The Women's Health Initiative that came out in 2000, so 15 years ago, really changed the way a lot of practitioners and patients approached menopause. There was a lot of negative information about hormones that came out with that study, and so I think that has scared a lot of people away from hormones, and even scared some healthcare professionals away from using hormones. But we have a lot of good data now that shows that in the right patient at the right time, that hormones are very safe. And then there's been some new medications come out, the selective estrogen receptor modulators, which are, it's a big term, but it just essentially means that they work on estrogen receptors like estrogen does. But they can be very beneficial. They also have other benefits like improving bone health and even preventing breast cancer in some cases.
Well, let's amplify a little bit, because the big scare about hormone replacement therapy was an increased risk for breast cancer.
Absolutely, and you know, we are Breast Cancer Awareness Month this month, so I know it's at the top of everybody's concern list. And a lot of my patients are very concerned about breast cancer when we start talking about estrogen. The studies, whenever you really break them down, the increased risk of breast cancer was more associated with the progesterone use. And the longer a woman used the progesterone part of the hormone replacement, the higher her risk for breast cancer. The estrogen, unless you have an estrogen-sensitive breast cancer, it was not really associated with an increased risk for breast cancer.
Okay. Some data seems to indicate that the age at which a woman begins entering menopause is predictive for longevity. Any truth to that?
I think so. You notice women who go through menopause early or who have surgical menopause and that they have a hysterectomy or have their ovaries removed tend to develop heart disease earlier. They may develop more severe diabetes earlier. We know that estrogen plays a role in metabolic function, so it's protective for the heart to some degree. Now there are still some conflicting data out on that, but we know that postmenopausal women are much more at risk for diabetes and high blood pressure and coronary artery disease and stroke than premenopausal women.
Okay. Well, most importantly, how does a woman know when menopause is over?
So menopause is an event. So it's that last period. So when you've not had any bleeding for a year, you know you have been through menopause.
And symptoms will abate?
So that's the tricky part. So some women will have symptoms for a long time, up to 10 years or longer after that last menstrual period. So the big thing that I like to tell my patients is that therapy is individualized. So what's right for one woman isn't going to be right for another woman. And some women are going to need estrogen to control hot flashes a lot longer than other women might.
How long can you be on estrogen therapy?
It depends on who you ask. So some of the government organizations and the Beers criteria, which is the geriatric criteria that helps us decide what's safe, have said that estrogen's unsafe after the age of 65. But we know that some women do continue to have benefits from being on estrogen therapy after that. So it's really a very individualized decision. So if the woman's willing to accept the risks of being on the hormone therapy, then if she and her doctor decide that that's what's best for her, then she can continue.
Very well. Learned a lot. Thank you very much, Doctor.
Thank you.